I am Dr. Leonard Ponraj, Professor of Arthroscopy and Sports Injury at the Government Super Speciality Hospital, Omundurar Estate, Chennai. Now, I am a sports surgeon. My basic qualification is orthopedics. You may want to know why I did orthopedics. Orthopedics, for every surgeon, his or her field is great. But I, for one, feel that orthopedics is a vast field. It's with a lot of subspecialties, and the basic of orthopedics is trauma. The one thing that fascinated me to take up orthopedics is you can actually operate from head to foot. Okay, so that's the beauty of orthopedics. And then as we go along, I'll tell you what are the subspecialties and how you can expand into them. But before you think of subspecialty, you have to get your basics when you're doing your MS orthopedics absolutely right, which will then help you to be a good subspecialty specialist. How to choose the institute? When I joined orthopedics, it was entrance exam. But similarly, you have NEET these days. Now, NEET, I don't think you have a choice, depending on the rank you get. If you're a top ranker, you can choose the institute. What you want, if you see, most institutes are geared for basic orthopedics. Now, I would suggest that if you have the privilege of being able to choose the institute, you want to choose an institute with a high volume orthopedic cases, which is very common in most government hospitals. As you will be aware, will not be as much as in the private institutions. So if you have an opportunity, choose the government institution where you will have more volume, more exposure, more variety of case, and on top of all that, you will have hands-on, tremendous hands-on. Now, the next question is how to proceed. You may think, how to proceed? What do I do after taking orthopedics? Now, as I said earlier, trauma is bread and butter. During your orthopedic training, you want to focus on trauma because only if you're a good trauma surgeon, when I mean trauma, we're talking about fracture fixation. You have to understand the principles of fracture fixation very thoroughly, because once you're a good trauma surgeon, only then, believe me, you can be a subspecialist. You can't just say, oh, I'm going to be a plastic surgeon and then ignore your training in MS Orth. Training in MS Orth is a wide training. You'll be exposed to trauma, orthoplasty, arthroscopy, spine, everything, and then eventually you make up your mind what subspecialty you want to do. So therefore, when you're training, you want to put your heart and soul and try to know the basic principles of management of each aspect of orthopedics, which is very, very important. Do not skip that. Very, very important. Orthopedics, I did started my orthopedic career in 1988. 88, 90, I did my D-Orth, and 1992, 92, 94, I did my MS Orth. Since then, orthopedics have come a long, long way. One thing you must remember is you must keep abreast. So the current advancements is, which has always been there, is arthroplasty. And in arthroplasty, new techniques keep coming almost every year. And the other subspecialty, which is the hot subspecialty now, is sports medicine. When I was doing my MS Orth, I have not seen an arthroscope, 94. 95, I went to England, and that's where I saw an arthroscope. So when I came back in 2003, nobody had still seen an arthroscope in a government hospital. So nowadays, it's all available in every government hospital. Every government institution has got arthroscopy set, an arthroplasty set, because this is a basic requirement for the Medical Council of India. So you will be exposed in your training to all subspecialties. So stay focused. And other thing you want to do is you want to think about research. Now, one other most important thing I want to tell you is textbooks. Do not rely on textbooks. Textbooks are easily minimum 5 years outdated. All these papers, current concepts which come in journals like JBJS, Journal of Bone and Joint Surgery, COR, Clinical Orthopedic Related Research, so on and so forth. All journals, they are peer-reviewed journals. Those publications are the ones which come in the textbooks. So textbooks are clearly 5 years old. So I would encourage you to, if you see a management of current concepts of management of Galeazzi fracture or Monteggia fracture, you just quickly Google and say, what is the current concept? The book may be outdated. So you must read papers, you must see Google and find out the current concepts and pick up the basics from the textbook. So that's very, very important during your training. And you also, in this day and age, publishing is very, very important. You must actually look for opportunities to publish, really. Any odd case that comes to the unit when you're on call, any abnormal case, odd case, you must see, can I do a case report? Can I publish this? If you get 3 or 4, 5 cases in a row, you want to ask your assistant professor or your chief, sir, is this worth a publication? Can I get a publication? Because the chief also needs his name on the publication, and the assistant professor will be happy. At the end of the day, you're going to do all the job, and then your name will also be there, and that will help you carry forward in your life in career progression. So reading journals, publication, research is very, very important during your course, and that is the best time. So you must do that. You may ask, sir, I'm a girl. Can I do orthopedics? Let me tell you, my first registrar in England was a lady, was a girl, Scarlett McNally. I still remember. She's a hand surgeon in south of England. And I had 3 lady colleagues. When I was a registrar in England, I had 3 girls who were my colleagues. And on top of it, my daughter wants to do orthopedics. She's in England at the moment. She's training in South London. And she wants to do orthopedics. So when I joined orthopedics, the people said, oh, you're the right person. You're muscular, you need a lot of power, but that's down in the bin. Orthopedics does not need power. It needs skill, it needs brains, and we have got a lot of instruments and gadgets these days. It's technique oriented, it's not power. So girls, if you want to do orthopedics, it's great. No bar at all. Please come along and do orthopedics. And if you find after doing orthopedics that you don't want to be fixing fractures, you have subspecialties like hand surgery, sports medicine, which you can do very well. Now, take this advice from me. I have seen this. I have been through it. In our country, after you finish, you're 25 now, 26 now, 27 now. You get your MS Orth. At 30 you finish. You, for God's sake, you are not a consultant. You are not take that off your mind. You are never a consultant until you do your fellowship. So don't say to yourself, I'm a consultant. So as you finish your course, 3rd year, you want to decide, right, maybe I should do spine. Maybe I want to be an arthroplasty surgeon. Maybe I want to do sports medicine. So you must think along those lines. And when you finish your training, then you must start applying for fellowships. And in my days, there wasn't any fellowship available at all in India. So I had to go out. But now we have fellowships all over the country. You can do at the end of the day, I still feel that a fellowship abroad will help and make you different from others. So do a fellowship in India and also do a fellowship outside. And if you want to do orthopedics, I would suggest do not plan to settle till the age of 35. You want to be studying, fellowship, gaining this knowledge, that knowledge. Equip yourself. At 35, think of starting practice, and you will do very well. You will be confident, and confidence comes, and that will reflect when you deal with patients. For example, the guy who trained me in Australia, I had to see the patients. He will walk into the room and he will just say 2 things. It will be an ACL tear. He will say, we can do it well. That's it. Patient will not ask any other questions. So confidence comes with knowledge and training. So be on the ball, be on the lookout. Now you may say, sir, if I don't get MS Orth, am I okay with doing DNB? Yes, why not? Now things have changed. Earlier on, DNB the institutions had a choice of whom they can give it to, but now that also is centralized. So depending on your rank, you can choose a good institution, and I don't see there's any big difference nowadays between DNB and MSR. And the salary is no different at all. It's equal, and sometimes there are good DNB guys better than MSR. So don't feel otherwise about it. If you get DNB, just go ahead and do it. You'll do well. So if my advice for anybody who wants to pursue orthopedics, for me, I'm the first generation doctor in my family. I'm a first generation orthopedic surgeon, and by God's grace, I've done well. Only thing was I stayed focused. So nothing comes easy in life. You can't say, let me see, I may want to do orthopedics. You have to be decided, focused. Once you're focused, you'll go after it. Once you go after it, you'll gain knowledge, you'll come up in life, and you'll do very well. Orthopedics is a great field with a vast array of subspecialties. There is no dearth of patients, particularly with our population. So it's a great field. I would encourage you to take it. All the very best to you guys. Thank you.